we will discuss diffuse abdominal pain, which is when a person cannot pinpoint the exact location of the pain, but can only describe it as being in the abdominal region. Mesenteric ischemia is one of the most important causes to consider when dealing with non-localized diffuse abdominal pain. This condition occurs when blood flow to the intestines is insufficient. If not diagnosed and treated promptly, mesenteric ischemia can be life-threatening. It usually affects the small intestine. In acute cases, an embolus originating from the heart blocks the mesenteric artery. Alternatively, intestinal arteries may gradually narrow due to atherosclerosis. Mesenteric ischemia typically affects people over the age of 60. The most significant risk factor is atrial fibrillation, followed by hypertension and diabetes. If treatment is delayed, mortality rates can reach nearly 80%. Pain is sudden and severe, often out of proportion to physical findings, and is frequently accompanied by vomiting and nausea. Without treatment, the condition progresses quickly, leading to intestinal death. The typical patient is an older adult with cardiovascular risks such as atrial fibrillation and presents with unexplained severe abdominal pain. CT angiography is the gold standard for diagnosis. Treatment involves emergency surgery to remove the clot or bypass the blocked blood vessels. The second most common cause of diffuse abdominal pain is gastroenteritis, an inflammation of the stomach and intestines. Although often called the stomach flu, it is unrelated to influenza. Gastroenteritis is usually caused by infections from bacteria, viruses, or parasites. The most common viruses involved are rotavirus and norovirus, while bacteria like salmonella and Escherichia coli often come from contaminated foods. Parasites such as Giardia are less common but still possible. Gastroenteritis is extremely common, and nearly everyone experiences it at least once, if not several times in their lifetime. The condition typically begins abruptly within hours, with symptoms such as diarrhea, vomiting, abdominal cramps, and fatigue. The children and the elderly are particularly susceptible. Gastroenteritis usually resolves on its own within 3 days, but may persist longer. The main complications include dehydration, electrolyte imbalance, and, in severe cases, sepsis, especially in children. The hallmark of gastroenteritis is the sudden onset of watery diarrhea and vomiting. Diagnosis is often based on symptoms, although stool tests can be performed to identify bacterial causes. The most common treatment is supportive care with a focus on hydration, especially using oral rehydration solutions. Antibiotics may be given for bacterial infections, and antiemetics can help control vomiting when necessary. The third most common cause of diffuse abdominal pain is irritable bowel syndrome. This is a functional disorder, meaning there are no identifiable structural or biochemical abnormalities. The exact cause of IBS is unknown, but it is thought to involve gut hypersensitivity and brain-gut dysregulation. The classical symptoms of IBS include abdominal pain, bloating, and changes in bowel habits, with patients experiencing diarrhea, constipation, or alternating between the two. Irritable bowel syndrome is more common in women under 50. There are associations between stress, anxiety, and depression with IBS. The typical patient is a young woman with a history of digestive issues or chronic stress. Symptoms are often relieved by a bowel movement. Some foods can worsen the symptoms. These foods are known as FODMAP foods. The hallmark of IBS is abdominal pain that improves with defecation and is associated with altered bowel habits. Treatment may include fiber supplements for constipation-dominant cases, a low FODMAP diet, and avoiding triggers. In some cases, a low dose of tricyclic antidepressants or serotonin reuptake inhibitor antidepressants can help. The fourth most common cause of diffuse abdominal pain is bowel obstruction. This occurs when the normal flow of content in the intestines is blocked. It can happen in the small or large intestine. The main causes of obstruction include adhesions, hernias, tumors, or twisting of the intestines. Sometimes functional causes lead to obstruction, meaning that bowel movement stops without any physical blockage, often due to infection or medications. With age, hernias cause disease, and recent surgeries increase the risk of bowel obstruction. About 70% of cases are caused by recent surgeries. Symptoms include crampy and colicky pain that worsens over time, greenish vomiting in small bowel obstructions, and constipation with an inability to pass stool or gas in cases of complete obstruction. In severe cases, surgery may be required. Complications of obstruction include bowel ischemia aiding to tissue death, perforation, or sepsis. The hallmark of bowel obstruction is abdominal pain, distension, and vomiting with an inability to pass gas or stool. High-pitched bowel sounds are often present in early obstruction, and absent bowel sounds occur in late or complete obstructions. X-ray and CT scan are valuable diagnostic tests, frequently showing air fluid levels and dilated loops of bowel. Intravenous fluids and a nasogastric tube are used to relieve pressure in cases of partial obstruction, while surgery is typically required for complete obstructions. Obstruction is common in people who have had recent abdominal surgery, suffer from chronic constipation, or have a history of cancer. The fifth cause is peritonitis, which is the inflammation of the peritoneum, the thin lining of the abdominal cavity. Peritonitis is usually caused by infection or intestinal perforation and is a very serious life-threatening condition. It is primarily due to bacteria, often secondary to a perforated organ such as a ruptured appendix, diverticulum, or stomach ulcer. Sometimes it results from trauma. Mortality can be high if untreated, especially in severe cases where the infection spreads, with a mortality rate reaching 40% in high-risk populations. Symptoms of peritonitis include a sudden onset of severe, sharp, constant pain that worsens with movement. Fever and chills are also common symptoms, along with nausea and vomiting, reduced or absent bowel sounds, along with abdominal tenderness and rigidity. It is typical in peritonitis. A board-like abdomen is a classic finding. Peritonitis progresses rapidly if left untreated, leading to multi-organ failure and sepsis. The classic patient is an adult experiencing sudden, severe abdominal pain, fever, and a rigid abdomen, often after a known or suspected gastrointestinal issue, such as a burst appendix or a perforated ulcer. As abdominal X-rays or CT scans are used to detect free air, which suggests perforation or fluid. Broad-spectrum antibiotics are administered immediately to treat infection. Surgery is required in cases with perforation or severe infection to repair the source, such as a ruptured appendix or abscess. Diffuse abdominal pain can be caused by other, much rarer conditions. For example, diabetes, malaria, familial Mediterranean fever, metabolic diseases, and psychiatric disorders can sometimes lead to diffuse abdominal pain. In diabetes, particularly diabetic ketoacidosis in uncontrolled diabetes or type 1 diabetes, severe dehydration and abdominal pain may occur. The pain is generalized and can be intense. The symptoms include nausea, vomiting, a fruity breath odor from acetone, deep breathing known as Kussmaul respiration, and confusion. Malaria can also cause abdominal pain due to widespread infection and systemic inflammation. There may be enlargement of the liver and spleen. Abdominal pain in malaria is often due to splenomegaly. A cyclic fever pattern is a hallmark of this parasitic infection.